Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to have a good friend of labor and of mine, Andy Johnson, who is the fund administrator for the Teamster Center Services. Andy, thank you so much for joining us today, joining the network. Give us a little overview of the Teamster Center Services and what you guys are doing.
Mike, thank you. Thank you for the opportunity to be here. Teamster Center Services is a great organization. I've been part of it for 30 years. Teamster was created by Joint Council 16 59 years ago, and it opened in 1962. And we are an employee assistance program. We also do case management. We also do advice and referral for the membership of 20 different Teamster unions located all through the Metro New York area, Northern New Jersey. And primarily, people call us, they need services regarding behavioral health. They need a referral for their child or for themselves to a mental health provider. And we really make our best effort to find them a local in-network provider who's available to see them, give them a large choice to choose from. Just sometimes just answer their questions about different services. Behavioral health is not like medical health in that it's really mysterious to people. It's just something they've never had to deal with. And so part of what we do is really try to break it down and simplify it and say, what are you trying to do? Get rid of some preconceived notions they have. We get lots of calls of people who say, I need a psychiatrist. And we say, well, why do you feel you need to be on medication? They go, oh my God, I don't want to be on medication. So we explain to them the different level of providers, and then we certainly help them to match them up with a provider. We deal a lot with families in crisis, that things are just going wrong with the union member or a loved one in the family, and just kind of walk them through what to do and find them local services. The other big role that we've played, especially Mike, in the last 15 years is we've been in the forefront of the opiate epidemic. And as you know, certain areas in Metro New York were the flashpoints for that epidemic, and it's not going away. Report just came out literally this week that 2020 has record overdose deaths, way above even 2019. So sadly, that epidemic continues, and we continue to be in the middle of it and really try to help people who need services, and most importantly, get them to appropriate services right away.
Thank you, Andy. That's a good overview. Tell us a little bit about yourself, Andy, too, how you got involved with the Teamster Center Services, your background and history as well. Again, you are a mentor and somebody I admire, especially for all the work that you do to support your members and the members of the team of Joint Council 16. So love to learn a little bit more and tell the members and viewers about you.
I've been extremely fortunate. I mean, my career path is, I say this, I take zero credit. I've been extremely blessed. I grew up in the Catskills, literally a one-stoplight town, and but went to college, got a degree in communications, which is what you do when you don't know what you want to do, and came out and started working at a state facility for adolescents. It was the only place hiring in upstate New York at that time where I lived. And I really enjoyed being a counselor. And these kids were there because they had broken the law many times. And I really enjoyed working with them. And I got training in substance abuse then, and ended up leaving that job and going on to a very low-level county introductory alcohol and drug counselor in Delaware County. But just from there, got lots of opportunities for training, got certified as an alcohol and drug counselor, and married my college sweetheart who lived in Manhattan at the time, and moved to Manhattan from my one-stoplight town. That was fun. After 6 months in Manhattan, my wife said, will you please stop saying good morning to everyone? They think you're crazy. So that was a slow process. And but there just happened to be this opening for an entry-level counselor with Teamster Center Services, which at the time was up on Gun Hill Road in the Bronx. We're now in Manhattan. The person who ran it, Betty Goldstein, was my mentor, and she was wonderful. And Betty was very supportive, and told me to go back to school and get my master's degree, which I did. And at that time, Betty got sick, sadly, and had to leave. And I was appointed to take over as the administrator. So really blessed, very fortunate, just kind of walked into that job at the right time, and really blessed with the trustees that we have. You know, the unions that we work with, their funds can put their trustees on our board, and many of them have. And so people like my board chairman, Chris Silvera, and lots of the other trustees, they've always been behind me, and they've always been behind what we do. When we have board meetings, it's always what are you guys doing? It's great. It's working for our members. How can we support you? How can we make it better? And, you know, Mike, when you work in an environment like that, it's wonderful. We love what we do. We love the fact that we help people every day, and we're a free service. All the funds chip in for us to be here. So for the membership, we're a free service. And I just last year celebrated my 30th year here. And I can't think of anything else I'd want to do. To just help people every day and not charge them for it is a lot of fun. And we also try to network with other unions everywhere across the country to just share with them what we do and what's working, so that they can take it back, whatever model we have, apply it to their situation, and hopefully they can come up with their own model that works best for them.
It's incredible, Andy. Thank you. And you are an incredible resource to reach out for the membership. Now, how do members connect to you? I mean, again, when you talk about substance abuse or areas like that you support, what's the process? How does that work? Like,
we get connected with two ways. Either the member, you know, even though we've been part of a lot of these unions for next year will be 60 years, that, you know, they don't know who we are. We might be in the back page of their SPD, or we might be a sign in the welfare fund office, but primarily, you know, someone might mention to their shop steward or business agent, hey, I'm really having this problem in my life. And they'll say, oh, hey, call Teamster Center Services. And that's quite often when the first call comes in. Or just someone might call the welfare fund and say, listen, how do I find an in-network social worker here in Long Island? And they'll tell them to call us. And that's probably where we get a lot of calls that way. And then we walk the caller, whether it's the member or their spouse, we just say, hey, we're here. This is who we are. This is what we do. And how can we help you? The other way that we get calls is, you know, where we might be on the back of the health card. And so a provider will call us. This, to me, Mike, is the most important way, because to be honest, there are still some serious bad actors out there in the substance abuse treatment world. When I go out and speak on substance abuse and the opioid epidemic, I always say there was two opioid epidemics. There was the opioid epidemic of people abusing opioids, and the other epidemic was these really mean-spirited, unethical people who quickly took their money, saw that the Affordable Care Act plus the Mental Health Parity Act kind of opened this Pandora's box of quick access to healthcare benefits. And as we know, many unions have pretty good healthcare benefits. And these people quickly began to target unions, target their kids, especially when the crisis, all these people suddenly covered till age 26. So when I talk to people at various events and they say, how do you deal with these unethical programs? The number one way that we deal with it is by controlling the flow of communication. So when an out-of-network, perhaps unethical treatment program, perhaps likely in Florida, when they call to check benefits, we're the people they call. And so when that calls in, number one thing we check is the member eligible? Is the patient eligible for benefits under one of our plans? Number one. Number two, is this program in network with the insurance carrier? And then we quickly speak to the patient and say, hey, we're not sure what you've been told, but let us give you the facts. Here are the facts. This facility is out of network. Most of these facilities, Mike, have on their website, we accept the following plans, and they've got them all there: Blue Cross, Aetna, Cigna, Humana, United Healthcare. And that's true. They will accept them. And then they'll balance bill the patient. And it can be significant. I, routinely see when someone insists on going out of network, which we always try to talk them out of. The facility bills $3,000 a day, and the plan allowance for out of network in that area is $400. So do the math. When you have that gap every single day for 30 days, people walk out owing $70, $80, $90,000 easily. And
Wow.
so we really work with the patients and let them know, hey, they're out of network. This is what could happen to you. We don't know what promises they've given you, but here's the facts. Here's what your plan's going to pay. And, we always say, listen, here's 3 in-network facilities within 100 miles of where you are right now. Do you want us to have them come pick you up?
Wow. Good. Thank you. Thanks, Andy. Incredible resource you are, I'm sure, and for the Teamsters. Every year you host an event, your annual Expo. Could you give us a little bit of history and information about that and the upcoming event that's coming this year right now as well?
Sure. The name of the event is the Health and Benefits Expo. I was really fortunate to walk into this. People a lot smarter than me started this before I took over TCS. So I inherited it. I like to say it's like planning your wedding once a year. And it's a great event. And the reason it's a great event is because it fills a void. It is a conference with a big exhibit hall, usually 50 to almost 60 exhibitors, and 5 educational workshops in the morning. And it's the attendees are trustees, administrators, key staff, key consultants for all kinds of Taft-Hartley Trust Funds and public trust funds. And it's a half-day clearinghouse, really, for a marketplace for people to come and meet with vendors they wouldn't ordinarily meet. And like I said, we have usually almost 60 vendors involved, and from hearing aids to vision to healthcare to liability insurance to all different kinds of things that a health fund would need. And it's just a great opportunity. It's a great opportunity for these funds to connect with vendors they wouldn't otherwise meet up with. And it's also a super opportunity for the vendors to finally get access to union benefit plans and just have a conversation, exchange business cards. And I tell you this, it's really important for funds to find out what is out there. And the example that I always give, I have a good friend of mine who's retired now, but he ran a Teamster fund for years, and the contributions just couldn't keep up. And at one point, about 15 years ago, they could see that they were heading to bankruptcy, that just contributions could not keep up with expenses. And they went out and they kind of thought outside of the box, and they brought in a vendor and applied that vendor to that plan. And by the time this person retired a couple of years ago, he told me that he can honestly calculate that hiring that vendor saved that fund over $100 million over the next decade. Wow. And, but that's what's out there. That's who knows? I can't guarantee that everyone will meet their $100 million savings at our event, but you never know. It's a great event this year. It's going to be on Friday, November 19th at the Sheraton, New York, Times Square, which is 53rd and 7th. We've had it at the Grand Hyatt for the previous 26 years, but unfortunately, the Grand Hyatt remains closed. So we weren't able to. We first were going to have it there, and the Grand Hyatt just got back to me a couple of weeks ago and said, we don't know when we're reopening. And we were really fortunate that the Sheraton, New York, Times Square stepped up, and they had a date that worked for us. Again, Friday, November 19th. And that's where we'll be. Starts at 8:30 and goes to about 1:30 in the afternoon.
Perfect, Andy. And I've been attending for the past probably 10 plus years. It's always an incredible event. It's always meeting different vendors, labor officials, executive board members, fund administrators. So it's a great place to go. I highly recommend any vendor that's not involved to attend, and you'll definitely meet some interesting and real professional people at this particular event. So I'm proud to promote you, support Teamster Center Services, joint counsel, and everything that you guys are doing for your members. It's an incredible organization, incredible program that you run, Andy, as well as your staff. They will send out the marketing literature and information as well as resources. So again, I want to thank you for everything that you do. And we're here to support you in any which way we can.
Great. Appreciate it. If anyone's interested, Mike, the website's being updated this week, the brochures, because we had to change the location and date. They're going out next week. So it's teamstercenter.com is our website. And there's the logo there for the Health and Benefits Expo. And everything will be up there, hopefully in the next 48 hours. But it's a great event. Everything hasn't sold out yet, but I will say most of the sponsorships are going quickly, and I encourage people to sign up early. It's going to be a great event. We look forward to seeing people there.
Thank you, Andy. Appreciate it. Look forward to seeing you real soon.
Thanks, Mike.
Take it easy. Take care. I'd like to thank Andy Johnson, his whole staff, and Teamster Center Services for all that they do to support labor and the Teamsters members within the Joint Council 16 and beyond. The Union Labor Advisory Network is a site to support, educate, and promote informative content relative to labor. I want to thank all of you for joining. Please subscribe to our YouTube channel. You can also reach us at ulanetwork.com, on our Facebook page, as well as Instagram. We're here to support you. If there's any informative content that you'd like to promote that's relative to labor, please reach out to us, and we'd love to help support you. Thank you, and have a great day.